Hi, I'm Dr. Ryan Stratford, a urogynecologist at the Women's Center. I'm going to talk a little bit about other causes of urinary leakage besides stress urinary incontinence. The most common type of leakage that occurs besides leaking from coughing, sneezing, or laughing is urgency leakage. That's usually associated with the desire to get to the bathroom and not being able to make it in time. The very disrupting part of this type of leakage is that it's usually a high volume, and most women are wearing pads all the time just to prevent that type of leakage. This condition is called an overactive bladder, and it's overactive because the bladder wants to contract without warning. There are various different things that can cause an overactive bladder. It can be the result of not emptying the bladder well. It could be the result of having a bladder that doesn't want to fill up very far. Whatever the cause, it is usually a nerve or a muscle cause. In other words, it's the bladder muscle wall itself or the nerves that communicate with it that are triggering that type of leakage. To treat this requires treating those nerves or treating the muscle itself. The first line treatment is to try to improve the capacity to get the bladder to respond to what you want it to respond to, and that's called bladder training. That includes timing when you go to the bathroom and holding and suppressing urges. To learn how to suppress urges, we will usually have patients see a physical therapist, a specialist in physical therapy that treats the muscles of the pelvis. These are those muscles. When you have control of these muscles, you also control the sphincter of the bladder. And by squeezing the sphincter of the bladder in quick, successive contractions, you can teach the bladder not to have urgency. It actually signals to the brain and turns off the signal to the bladder. So by doing that, in addition to timing your voiding and controlling your fluid intake, we usually can get control of the problem again. And in 2/3 of the cases, we can solve that overactive bladder condition. If that doesn't work, then there are medications that have been created. The medicines do have small side effects, but are very effective and can be used on an intermittent or a regular basis. If that's not successful, there are nerve stimulators. In fact, nerve stimulators that can be permanently implanted that turn off the leakage. Nerve stimulation can also be done intermittently with a small little acupuncture-sized needle that's placed in the ankle, and that's done on a weekly basis. There's also injections that can be injected into the bladder wall to make the muscle paralyze itself not to contract so frequently. All this can be done in a very conservative and easy way here in the office. So these are treatments that are available for treating an overactive bladder. The good news is that we work our way up from a conservative treatment approach to a more aggressive approach until we can get this resolved. Most of the time we can treat it, and almost all cases turn off that leakage that is so bothersome. If you have further questions, I recommend you going to our website, thewomenscenter.com, and click on my ebook, A Woman's Guide to Urinary Incontinence. That will be very helpful in learning more about this. Or you can tune back into my YouTube channel.